Hi, I'm Leslie Roberts with Ultra Medical. We're doing a short video today for one of our clients that wanted to see how the OnSite AED Trainer worked. This is the unit. It looks exactly like the real OnSite AED. Icons, buttons, and everything look the same. The only thing that looks different is the cartridge itself, same dimensions and everything. It operates on AA batteries instead of the actual real batteries. The AED trainer comes with the trainer, carry case, and a metal strip that will go on the mannequin, and I'll show you how that works. We also have an optional adult placement guide that we use, and I'll show you how that works as well, that we use a lot in terms of for demos and training. I'm going to put these aside and show you how the trainer works with the mannequin. You can choose one of 8 different scenarios. They're listed on the back, and to change the scenario,
insert pads cartridge.
You'll do that when you first install the cartridge.
Training. Press the flashing blue button to choose training scenario. Scenario 1, Scenario 2, Scenario 4.
So you can go through a lot of different
Scenario 6, Scenario 1.
So I'm going to use 1, which is 1 shock followed by a non-shockable rhythm. And so all you'll do is your normal training scenario. You'll have somebody, whatever your scenario is, you're going to have them check for responsiveness, go call 911, get the AED, have people start CPR until the AED comes, and then when it arrives, you'll have them, down on the floor next to the mannequin. I'm not going to be down on the floor for the demo, but obviously you want it to be as realistic as possible. You're going to pull the handle or push the button to start it, and it'll start talking to you.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
And in the carrying case, there's scissors.
When patient's chest is bare, remove protective cover and take out white adhesive. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
And the pictures on the pads look exactly like the real pads.
When the first pad is in place, look carefully at the picture on the second. No one should touch the patient. Analyzing. No one should touch the patient. Shock advised. Stay clear of patient. Press the flashing orange button now.
So it has the same shock button like you normally
Shock
see.
delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button.
So obviously they could start compressions and without getting coaching, but you can push the
Place
button
the heel
like
of
the
one
real
hand
unit and
in
get
the center
CPR
of the
coaching.
chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat.
So it has the metronome to follow in terms of CPR, and I can't do this on a table very well, but it will coach you in the rate of 100 to 122 beats a minute, just like the real AED would. And it will go through.
Pinch nose, tilt head, and give 2 full breaths.
So you can
Breathe.
do breaths. Breathe.
Breathe. Continue with compressions.
So it'll go through the cycles, the 4 cycles of 30 compressions to 2 breaths, and come back around and analyze again, just like the real unit. I'm going to turn it off here. And obviously you'd have it down on the floor, you'd be working on the mannequin. It's just easier to demo it up here. So that's how the AED trainer works. Let me show you how you can also turn a real AED into training mode as well. Then you can also take the real AED and turn it into training mode. All you need to do is pop the real cartridge out.
Insert pads cartridge.
And put the training
Adult
cartridge
training
in.
pads. Training. In case of emergency, remove the training cartridge and insert pads cartridge. Press the flashing blue button to choose training scenario.
And likewise here, you can choose
Scenario 1.
you can choose your training scenario. So we're going to use number 1. And you can have your students with the mannequins, which I just showed, but you can also use a paper man or a placement guide on top of the mannequin when you actually start to use the defibrillator instead of the strips. In that case, and this also is a great tool for a refresher and just to demonstrate how to use the AED. In this case, you're just going to turn it on and follow the prompts.
Begin by removing all clothing from the patient's chest. Cut clothing if needed. When patient's chest is bare, remove protective cover. Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic line. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. No one should touch the patient.
Proper placement is.
Analyzing. No one should touch the patient. Analyzing. Shock advised. Stay clear of patient.
So again,
Press the
clear.
flashing orange button. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For
You
help
can
with
also-
place the heel of one hand in the center of the chest between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with
So
the
it will
beat.
guide through just like the real unit. And I'm going to turn it off. So anyway, that's a way of demonstrating with a real unit and as a refresher of how to use it. You could also use the paper man with the mannequin, or you can use the paper man with the trainer. And when you use the real AED, it does use a couple of minutes of battery life, but the batteries have a 200-minute life, and it uses about a minute or 2 for every scenario that you use. So you really don't use that much battery life. So those are the 2 options. You can do the AED trainer, or you can use the real unit in training mode. The difference is the cost of the cartridge is a lot less than the cost of the trainer. You're looking at about $84 for the cost of the cartridge, and you're looking at about $359 or so for the trainer. Hope that answers your question. Thank you.